Good morning, everyone, and thank you for joining us on this Friday's webinar. I have several announcements that I'd like to make today, beginning with. We will be moving to an every other week schedule for these Friday webinars beginning in August. So that means that there will not be a webinar on Friday, August 7th. So I'm not sure that you'll be able, it may be a little hard to adjust next Friday morning at 10:30. You may want to hop on, but we won't be here. So that means no webinar next Friday. And then the first webinar that we'll jump into the schedule with is Friday, August 14th. And the registration information for that is already on our website. So you can go ahead and register for that and be prepared for when we start again on August 14th. If by chance you had already signed up for the August 7th webinar, no worries. I haven't canceled that yet. I wanted to make sure we have the announcement out first. So you will get a cancellation notice for that August 7th if you already registered. In addition, as things have, and I'm using air quotes here, slowed down, because not really slowed down, they've changed, I guess I should say. We will no longer send out summary email blasts on Tuesdays and Thursdays. Instead, we'll just push out that information as it becomes available via email blast. Note this means that on occasion you may get a couple more email blasts than usual, but we will try to keep a good rhythm as we ensure that you're well informed. And then quick housekeeping item. As we continue to try to streamline and be more efficient in receiving those questions as they come in and responding to them, I'm going to encourage everyone to submit your questions via the Q&A box. That way our folks that are presenting and myself as well, as we're looking through those questions, we're looking in one spot and not having to toggle back and forth. So I think we'll be able to do a better job of managing those questions that come in. We'll reserve that chat box for addressing any technical questions if for some reason you lose sound or there's something else, systems-wise that you're having trouble with. I'll do my best to address those. And I think that is absolutely enough for me this morning, so I'm going to turn it over to Val.
All right. Thank you, Heike. Thanks for the update, everybody. I'm back this week. I was gone last week. So we'll go ahead and get started. A couple of things from our fusion cell, and Heike is going to do some driving, and I'm going to try to watch I'm going to try to walk over here. If you can't hear me, let me know, but I'm pretty loud. So we're going to show some stuff on the screen today, but first I just kind of want to go over the numbers. So the state's numbers are 48,834 cases. Yesterday was our biggest day of cases ever. There were 2,084 cases. Average age of cases is 43 years old. The average age over the last 7 days is 41. So Heike is now showing you right now the, okay, go to the, sorry Heike, can you go to the cases demographics page, please? That tab up there, so you guys can see this. So this will show you right now the average age of COVID-19 patients are 43 years old. In the last 7 days, that's 41. Now, there's a box right next to that where it says Missouri COVID-19 cases by age, and you can see how this is delineated among all the ages. And then, Heike, can you do that click here for a more detailed breakdown of cases by age? There you go. Okay, and you can see scrolling down here, a lot of cases under the age of 20 and a lot of cases between the ages of 20 and 26, and even really a lot of cases under the age of 30. So what that's telling us, that's a lot of folks that are in our workforce, so we really, really, really need to be paying attention. We need to really make sure that our screening processes, we are doing them everywhere. When they leave, when they come back, before they're going to be out, just so that we know if people are running fevers, if they're having a hard time breathing, any of those kind of things. So I just wanted to point that out because I wanted you to see the ages of cases right now so that you understood where it's likely coming from. And that's why that integrity of that screening process is so important. Just for the division for the month of July, we had 118 new cases in July of individuals in the waiver that were COVID positive. Up until that point, we had 60 total. So we were averaging 20 cases a month for April, May, and June. In July, we had 118. So again, I just want to make sure that we are really, really, really
focusing on those screening processes because those are really, really important. Okay, Heike, the next thing we were going to look at was the map. So one of the other things that we talk about a lot is our where we have remote services only for case management. And we're working on getting this cleared up a little bit, guys, so bear with us. But if you, depending on how you access the internet is how clear this is going to be. But you can see here that now we also have a list down below of the counties that are remote only and the date that they were remote only. But we've also got up above, you will see we put it in a map form so it's easier to identify more quickly. So if you're red, you go down, you find your dates, we figure out where we're at. If you're turquoise, you know you're back in. We continue to look at this. We look at a lot of factors when we're looking at who we move to remote only, including, I know there was a question around hospitalizations. We look at hospitalizations, and we've shown you guys the Missouri Hospital Association dashboard, but they've even got an indicator that if they are okay with their level of open bed space, if they're not okay with their level of open bed space. So those are some of the things that we look at when we're making those decisions. Okay, so thank you, Heike, for driving there. More on the Fusion Cell, there is a resource out there. It's called Show Me Response, and it is a volunteer resource and that medical professionals can sign up. That's nurses, EMTs, physician assistants, doctors, that anybody who is capable to help respond in an emergency. So that is another resource for us as a state, and I know that we've had some providers reach out to us, and and even our state agencies, and we've been working with our internal resources to access any help through Show Me Response. So I'm not sure, we haven't used Show Me Response yet. This would be our first time using it, so we'll keep you up to date on how that's working, but I did want to share with you all that Show Me Response is a resource that we have. On testing, and thank you for everybody who continues to complete testing. We hear really good results from providers that as they finish their testing about how their employees feel, how their residents feel, how their families feel once those testings have been completed, and you can move to a more sentinel testing. I do recognize, though, there are some struggles right now with lab capacity. Missouri went from doing about 30,000 tests a day to doing tests a week to doing 90,000 tests a week, which is phenomenal. And that's why I really think we've been able to see a decrease in our ages, because we don't have the number of people over 80, over 60 testing positive like we used to have. But because we're testing a lot and we can identify the asymptomatic folks, isolate them, and get them out of there. With that said, though, we do recognize that there are some challenges with lab times, and we continue to work with our testing partners, the federally qualified health centers, to identify ways to improve those lab times. And there's a couple of things out there that we're working on. One's around how labs run tests, which I won't go into. But the second thing I wanted to talk about is the alternative test. So the test most of us are familiar with is the Tickle Your Brain test, where they stick that thing way far up your nose, and you've got to have a healthcare official actually complete that test. We're trying to, and our testing partners, the federally qualified health centers, are working hopefully through the next 2 weeks where we can do that mid-nasal self-administer test. Now, not everybody can self-administer, but it's really a test that you just have to watch be done, and a medical professional doesn't have to watch be done. You just want to watch to make sure you've got another set of eyes on someone when they're getting the test, and make sure that they put it away correctly and all those kind of things. So that is something we hope to be moving to. I think that will make it a lot easier. Not having to have somebody administer the test is one of those steps that will make testing easier. So that's one way that we're working on testing, and then the other side is on the lab side and how we increase that lab capacity for testing. So stick with us on testing. We know it's frustrating sometimes still. But remember, it's not as frustrating as it was. So don't forget that. It has come a long, long way. I don't really have a budget update at this time, but I did want to tell everybody, okay, there's that Federal Provider Relief Fund, and I know we've sent some information out to folks over and over and over. They extended the deadline for that Federal Provider Relief Fund until August 3rd. For those of you who don't know when that is, that's Monday. We got some information from CMS earlier this week that fewer than 200 out of almost 6,000 providers had actually applied for this Provider Relief Fund. You really just have to apply, and you will get it. That's all you have to do, but you have to apply. And this is a federal thing. I can't help you with it. I don't know anything about it. But I just want to make sure that you are, if you haven't done that yet, you need to do that. I kind of equate, and it's going to take you some time. So I don't want you to think it's not going to take you some time. It is. Gary tried to do it on behalf of the state. We found out we couldn't do it because we'd already gotten money from some other, but he went all the way to the end where you hit submit and it said reject. So it will take some time, but it's time, and you will get money. So if you have not done this yet, you need to be spending your rainy Friday afternoon or Saturday getting this done. Because we're going to get a list of providers that applied that actually received this money, and it's going to be real tough to justify why you need money somewhere else if you haven't been trying to get it every chance you can get it. So wanted to make everybody aware of that. The other thing, let's go non-COVID, right? Let's talk about the Fafsability Survey. So I know we are getting ready to wrap up the Fafsability Survey, and we want to be statistically relevant. I think right now we've got about 50% of the respondents we need to be statistically relevant. So if you can reach out to your folks to see if they've completed the Fafsability Survey, that would be fantastic. Then, oh, yes, thank you. That's good. I didn't have that on my list. Okay. There's a couple of questions. So the first question, Heike, we're going to do, and I want you to go to that other site for me again. Heike's driving again. Here she goes. So we have this question. I know in a recent Friday call, it was also mentioned that we should report through the DHSS web portal if there was a COVID positive case. This is not referenced in the updated memorandum. So I just wanted to ensure I understood that correctly. Yes, you should. What reporting this way gets you is on other people's radars, okay? And like I said, I like it when people call and say, hey, did you know so-and-so had positive? Then I can say yes. That makes everybody very, very happy because we know what's going on. So that's what we were talking about. If so, okay, so Heike, can you click on that purple button that said congregate facility reporting positive COVID case? Click here. And then click yes, because you got to go out to their reporting system. The question, though, is, if so, what is the type of facility that ISL should select at this time to ensure it is routed to the appropriate location? Now, at this time, because there's going to be a new form for this, it's going to be much clearer to understand. But today, Heike, can you click on the types of facilities for me, that drop down? And you would click mental health facility. That's all we need for it to come to the Department of Mental Health. And yeah, if we could have fixed it and made it say Department of Mental Health, we would have, but hindsight's 2020. There's going to be a new reporting system that we'll walk you guys through at some point. But that would be what you would click at this point if you are a mental health contractor. So, which is what you guys are if you're a contractor with the Division of Developmental Disabilities. So that was a great question. Then the other question we had was about, do you require 2 negative tests for state support coordinators like you do for DSPs and state operated? Okay, we no longer, as of Tuesday of this week, based on the new CDC guidance, the department no longer, and this is both for state operated and for psych hospitals and for our state waiver homes, we no longer require 2 negative tests to return to work. So depending on the severity of your illness will depend on when you can return to work. So if you have mild to moderate symptoms, 10 days from your positive test or the date you had symptoms, if you are no longer or if you have limited symptoms and no fever, you are now allowed to return to work. And depending on where you work would depend on the level of PPE you would be required to wear for 2 weeks. If you had more severe symptoms or you're immunocompromised, then it is 20 days post positive test or the day you became symptomatic. Still no fever, that's still a requirement, and symptoms have subsided, and then you also will have to follow certain PPE requirements. We have posted that, I believe, on our website. If we haven't, we're in the process of getting that posted on our website for you all so that you can look to follow that too. But we are no longer requiring the 2 negative tests. The CDC no longer recommends that as a viable option. So great question. I actually had that on my list, and I forgot to transfer it to the second list, so I'm really, really glad somebody asked that. Okay, let's move to Gary.
Okay. I'm just going to give a couple updates regarding the $20 million in provider relief funds that's being issued by the division. So we've been getting some questions, and we're starting to get applications in. Thank you. We've been getting some questions for the residential side on lost revenue. So lost revenue is not a category for the residential relief funds. It has to be related to expenditures. Now, if you're still providing some supports for individuals you can't bill with, you may have some expenditures. So look at things in terms of unreimbursed expenditures due to COVID, but lost revenue is not a category there. Also, we are receiving some applications, but we are still working on the accounting end. I guess we were moving too fast. We're still setting up some things on the accounting end, so maybe by next week we may be coding some payments.
So we will be coding payments by next week.
We will be. Val says we will be. Okay. That and some other questions we've been getting. We had a question about how can the funds that the provider receives be dispersed. So your attestation and your invoices for expenses you've already incurred, how you disperse that, I think, is up to you. So that's not part of anything we're looking at. And then on a different subject, so we've been asked about Zoom and WebEx and using Zoom for monitoring visits. So Zoom is okay, it's just that Zoom is not supported by the state of Missouri for its employees. Our official platform is WebEx. So state employees cannot initiate Zoom meetings, so you'll be using WebEx. But we do participate in Zoom. Other agencies we meet with, or even, I think even federal agencies use Zoom. So we participate in those. It's just the state of Missouri does not support it as something that a state employee can initiate.
Gary, can I jump in there really quick? I did provide a response that we received from our internal piece regarding Zoom, and what we had given some direction and guidance in some recent things that we've put out, that is, if you are using Zoom, make sure you're using a password ID for the meeting and waiting room setup,
okay,
and to
right.
view and approve participants. So I did want to toss that in there as well.
Right, it has to be secured. Okay, that is all I have. I will turn it over to Wendy.
All right, good morning, everybody. I'm going to touch on the provider COVID plan that we started talking about a week or two ago. We've gotten some questions in just to understand why is it necessary. We have been working with some providers here recently that have had positive COVID cases, that it is clear that they haven't thought through some of these components that need to be considered in your planning process, like how are you going to quarantine? How are you going to isolate? What do you consider? What are you considering around your visitation practices and those kinds of things? And so the division is here to provide technical assistance and help you consult on different things and problem solve. But we really need you guys to be getting these plans in place. It doesn't have to be fancy or formal. You might call it policies and procedures. You can call it a plan. I don't want you to presume what something should look like based on what we call it. So we're kind of dancing around words right now. But it can be one document that you put all your guidance around your COVID policies or practices into, or you may already have it established in some standalone documents around these different topics, and you can pull those together, and that's your plan. That is completely fine. We're not mandating what that looks like. The things what we are looking and asking, and we'll be providing some guidance out there, is just around the components that you need to consider. And for some good guidance, you can go to DHSS's long-term care facilities reopening guidance that's out there. They have components under considerations that are listed along with strategies that you can consider as you're building those policies. So that's a really good resource out there, and we will reference that as well. But it includes things around visitation, essential and non-essential healthcare personnel. Who are they? When do they report to work? How are they to be considered? You know, we went through that early on when we had the shutdown order. Well, if you're essential personnel or not essential personnel. Communal dining might not make sense in an ISL, but if you're a larger group home and you're all around the table, what are some other strategies there? Are you eating in shifts? Get some TV trays, spread out. You know, how are you doing that? So consider some things there. Medically and non-medically necessary trips. Here's where I encourage people to really know and think about talk with your primary care physician and know what they're going to be able to respond to. If you've got a client that's not feeling well and you call their primary care physician, can you expect a call back from them that day in a timely manner? Is it going to be 24 hours? I know with mine, they tell me right on the recording, because you're always going to leave a message that if you call by a certain time, they'll try to get back with you by the next day. If you have someone that is symptomatic, don't wait. This is why we have Station MD. Use Station MD. Communicate to your staff that this is a part of our response plan. They will keep in touch with the primary care physician as well and let them know what is going on, but it doesn't leave your staff sitting around wondering what to do and concerned if they should be isolating or quarantining or are they exposed, and just ramping up that anxiety. So give some guidance in those documents there around how to use Station MD, when do you use your primary care physician, and how to respond to those things. Guidance around group activities. Screening of staff and individuals served. Val's already talked about that. Universal source control. So control where people are coming in, where they're entering and leaving the premises. Don't have everybody coming in and out of multiple doors all over the place. So especially if you to enhance your screening protocol, you make sure that you're seeing everybody that's coming in and they're coming in at one place. How are you managing your PPE and how are you managing your testing? What are you doing along those lines? Who do you contact? Where do you go? What is your cleaning protocol? Who is doing that? How have you stepped it up? And then how are you managing quarantine and isolation? One thing I want to emphasize is this is not a document or anything that you're doing for us, for the division. This isn't to meet some requirement. This is not a checkbox. This should be meaningful instruction to your staff and your management team about how you are carrying out these processes and what your resources are and where you go for this and what do you do if this happens. It should be meaningful. And in most cases, it's going to have to even be broken down. In some cases, it's going to be agency specific, but in a lot of cases, it is home specific because quarantine and isolation is going to look different in every home. Especially if you've got folks that share bedrooms. That's going to be a really, really difficult situation for you to deal with. And so you might need to think about how you might get some help and what you would do if you needed to create some quarantine and isolation situations. At this point in time, these policies and this plan, this COVID plan, for lack of a better term to call it, is really directed at the service providers to have those plans in place and so that you can be proactive and know what to do when something arises. It doesn't apply to the TCMs, although all TCMs, I think, probably do have or should have a plan in place about how they are going to make sure that their PPE is in place and how their staff should be using it and protecting themselves when they're going out on visits, and what is the protocol and some guidance and training around that. And how are you going to ensure that you're maintaining your monitoring responsibilities if you have staff that become sick or you have turnover and you can't, you need to find someone else to cover some of those cases so we can ensure that there's continuity in the monitoring. And how will it be monitored? So again, we are not approving these plans. We are verifying that there's a plan in place. So PR will be reaching out. Again, we'll share with you in the guidance to verify that you have practices outlined in one way or another around these components and that they're in place. We're not approving them and we're not critiquing them. So they have to work for you. You have to give that thought. We don't have that level of expertise. But again, if you need technical assistance or you want some consultation, reach out to PR. And if they don't have the answer to your questions or can't help you problem solve, they will find the person with the expertise that can help you with that question. I think, and I say just keep in mind that this is evolving. So whatever we put into place today will probably change tomorrow and certainly by next week. So in another month, you find there might be another component that you need to add to this plan and that you need to talk about. We're all learning together. We're all learning as we go. So be patient, bear with us, and we will all be patient with you in working through your questions and how to get these things implemented. Another thing that we are in the process of getting our guidance out on, we've been working with a team with MAC and our internal state resources on in-person monitoring and getting back out and doing that. So there will be some guidance coming out either later today or early next week around that. But we're just trying to approach this re-entry into doing in-person monitoring slow and learn from our experience. Again, this is an evolving process, and we're going to learn new things as we get out there and try to get doing. But just know that the priority is that we're meeting with people face-to-face, so we're actually seeing them. And there is a way to do that safely, no matter who you are, no matter where you live, no matter what your health status is. If you are meeting with someone at their home, through a closed window, through a door, it doesn't matter if you are immunocompromised or if you are coming from a county that is in a closed remote-only county status, you can do that visit safely. You are not coming in contact. You cannot, that barrier is going to keep any spread from happening to you. So there are ways to do it. We're asking you to be innovative. We know that people are nervous and scared about it. And so we're wanting to step into this gradually, but step into it nevertheless and get out there and start doing those visits. Work with providers or families who are nervous about it. Talk through it. Talk with us. Again, we'll be happy to help you talk through things and problem solve. That's what we're here for. But we need to get out there and do that. We had a lot of conversation around support coordinators actually living in counties that have the remote-only status, and recognizing that a lot of providers have staff that are going to be living in remote-only counties. And so again, you just have to look at and be creative about how you're going to do it safely, but there's no reason that a support coordinator in a remote-only county can't go into another county and do their visits. We are going to be sending out a bulletin today or early next week around requiring all providers to have virtual video capability in one form or another. It doesn't matter if it's a smartphone, a tablet, if you're using Zoom, if you're using whatever it is, as long as it's one of those that's safe, it's not public-facing way to monitor. But we have to get to where we are actually seeing people in circumstances where we can't see the home because we're not going into the homes at this point in time, at least in the vast majority of cases. We've got to be able to, for support coordinators, to be able to do all the components of their monitoring, which means looking at the environment, making sure that there's food on hand, and different things like that. It's also necessary for providers who, your management staff hasn't been able to get, and supervisory staff haven't been able to get into the homes as readily as they would before too. So know that effective September 1st, we're expecting all providers to have the ability to do a virtual visit in one way or another. If you have problems, if you have questions, reach out, talk to us. We can help you problem solve. Getting this equipment is something that you can turn into this CARES funding, so it can be a part of that funding while it's available. Val, can they even do the internet if they have the service access? So any cost you have for COVID, that would be a cost for COVID. Okay. So, take advantage of that while you've got it. Use it to get the equipment that you need. You also have an opportunity through MARF. They've got a grant for equipment and technology for Station MD. So if it is a tablet that you're using, that's something that you can get through those funds. Keep that in mind and take advantage of that. The last thing I have to touch base on is Tuesday's Stories from the Field call. I think we've talked about that we're changing the format up, and we're going to do focused topics and have, again, panels. The idea is for it to stay conversational and not be preachy. And so we won't be having a call this Tuesday because we're going to be planning about our topics and getting it on the calendar and figuring out who our panelists are and just doing some prep. But we will be ready to go the following Tuesday with that call and start those up as usual. So stay tuned for more information.
All right. Thank you, Wendy. I know, we're good for you. Okay, we did get a couple of questions that came in real quick, and then we'll wrap this up. There's a couple providers that had mentioned they had not heard from their regional office. They don't know what their provider allocation is. Please contact your regional office director if you have not heard what your provider allocation is for this state. This is the state funding. It may have just gone to a different person in your agency, lost email. We all know how that goes. So please reach out to your regional office director to get your allocation. You should know that at this point. Also, remember, those allocations are only available for group home, ISL, day hab, and employment providers. So if you're not in that category, you didn't get an email, and I'm sorry about that. We continue to try to figure out ways to get more reimbursement out to our providers at this time. Another question that we got was around, and we had early on, just this is among the state staff, or the state staff on the call, we were asking regional office staff if they would be able to work in facilities, if we needed support in facilities. That has kind of gone to the wayside because we've been able to manage our outbreaks a little better there, but we can talk about if that's something we want to continue to do. Also, we've really been able to identify better how people can work remotely from the regional offices. So we're not looking for ways for people to fill a 40-hour week. But if we've got regional office staff that do want to volunteer assist help in a facility, please work through your regional office director and we can help figure out how to get that done for you. Then the last question I had, and I think this is a question about the federal provider relief payment that I talked about at the first part of the call. And I'm going to look at Gary, and he doesn't know this is coming. This is our favorite, right?
Yep.
So it said expenses in the federal. Did it say expenses for March and April only? Did you have to document anything around expenses?
You have to supply a tax return, so they're looking at 2% of revenues.
So I'm not sure that this, but you didn't have to fill anything about expenses. Okay, no. So then this must be, and I'm not sure, I don't want to call the person. Jeff, I'm not sure if this is about the federal one or the state one. If it's the federal one and it's asking you for March and April expenditures and you didn't have any, I don't think it is, but if it is and you didn't have any, that's fine. You should still apply for the federal one because the federal one is not expenditure-based. It is revenue-based. Mm-hmm. So you will get a percent back based on your revenues for a period of time. So I want to make sure that anybody that's applying for the federal, if for some reason it's asking for expenses, it may just be to collect data, but it is a revenue-based payment is what it's based off of. On the state one, if we got somewhere in the document that says those expenditures were only for March and April, we're sorry. Those expenditures go until December or until you run out of your allocation. You can invoice us multiple times. So if somewhere we missed those two words, we really apologize. But really, I mean, I expect to get invoices in October for August expenditures if a provider has not exceeded their allocation. So, okay, with that, thank you guys for all you're doing. Please continue to be vigilant. I cannot stress that enough. We've seen a lot of cases come up lately, and if the screening process would have been there, those probably would not have happened. So please, and I know it's hard, and you've got new employees or you've got tired employees, but please, please, please help us get that point across because it's affecting our employees' age groups, and we want to make sure they're taken care of as well because that's how we take care of their families. Also, FYI, I don't know if you guys have noticed it, but it's been raining a lot here over the last couple of weeks. I know we've got some homes that are flooded, so, you know, like COVID's not enough, let's add a little flood to that too. So just take care of everybody, watch out for everybody, call, trust but verify, okay? Thanks, have a good week, bye.